And that sets us up for Dr. Margaret Hamburg, who served as FDA commissioner for nearly 6 years under President Obama. She also oversaw diagnostic testing of both Ebola and H1N1 in that capacity. She also once served as New York City's health commissioner. Dr. Hamburg, good morning to you.
Good morning.
Before we get into the testing issues, I'm hoping you can break those down for us. Let's talk about the reopening, partial reopening of some states. We've heard about South Carolina, Tennessee, in Georgia. They're even going to allow, nail salons and gyms and tattoo parlors to reopen. Do you have a thought about the wisdom of that?
I am surprised, as was noted in your earlier story. Some of these places are not even meeting the minimum threshold criteria that was put out in the Trump White House coronavirus task force guidance. I'm worried that we don't know enough about how the virus has penetrated their communities and their states. We don't know about the possibility for explosive spread of the virus as people go back into these social gathering settings, the workplace, schools, whatever. So I hope that they will think carefully. I hope they will move forward slowly. And certainly they need to have in place adequate testing capacity, ability to identify those who are infected, make sure they're isolated and not spreading to others, and be able to use public health measures of contact tracing and quarantine to better surround and protect against ongoing spread.
Well, let's talk about this testing issue. It was just laid out fairly nicely. Before we get into the breakdown of what's going on here, how much testing really, in your opinion, needs to be done? I mean, there's reports that we do about 150,000 tests a day in this country, diagnostic tests. What's the right number? What's the ballpark?
I don't know that there is any right number. Certainly, many people who have looked at this deeply think we need to be doing somewhere between 3 and 20 times as much daily testing as we're doing, and it will vary in different regions of the country. One thing that is clear is that from the very beginning of this novel coronavirus epidemic in our country, we have been behind where we should be in terms of testing, and that has made it really hard for us to even fully understand the nature and scope of this epidemic. And so we need, even with everything else that's going on, we need to have a flat out, all hands on deck effort to be able to expand testing availability, quality, and we need more rapid testing, because in some places, as I talk to health commissioners and hospital CEOs and people in the healthcare workforce, many tests, unfortunately, are being quite significantly delayed. And you mentioned about the shortages in swabs and reagents. That was a problem we saw coming. We cannot let it now fester. We have to really mobilize and address it. And it's going to be hard. And as Governor Cuomo said, we really do need the federal government to help spearhead this effort so we can get what's needed in terms of tests and the tools to do those tests and get them where they're needed.
Well, we use this, general term testing, but as you well know, it's very complex. I mean, it's about, do you have enough labs? Do you have enough kits? Do you have the reagents, the chemicals that help you get your results? Is there too much time that takes to get those results? Do you have the swabs? I mean, where in the process are we having the problems? Because frankly, people are out there hearing one thing from their governor, another thing from the White House, and it's just, very confusing.
Well, it is confusing, and there are lots of different kinds of tests, has been noted as well, to make the discussion even more complex. But I think the critical issue is that you have to have a complete test kit with the swab and the reagents to be able to do the test, and we have to pay attention to that. We also have to make sure that we're using a limited supply of tests wisely and targeting the places that need it most to make critical public health and healthcare decisions. But unfortunately, all of the pieces of this puzzle have not yet come together. It can be solved. It's not that complex, but it does require leadership. It needs a systematic look at the supply chains and the distribution, and we need to continue to push hard on this, because as states move towards reopening, testing is one of the absolutely essential tools of doing this safely and avoiding the resurgence of the kinds of challenges that we've seen.
Well, as you mentioned, there's a lot to talk about. We're out of time right now, but I hope you'll come back and tell us more about it. Former FDA Commissioner Dr. Hamburg, thank you very much. Appreciate it.